Hi, I am Jen Wilson, the Healing Rebel, and these three exercises are Stuart McGill's big three for back pain. I'm going to show you the basic exercise, and then I'm also going to show you some adaptations if the basic exercise is not available to you. So the first one is going to be lying on your back with your knees bent, with one knee bent, other leg long. Now press out through the sole of your foot so that this long leg is active. This foot here, pressing down into the floor. We're going to take our hands into the lower back, and you can jam your pinkies into the top of your butt cheeks just to help stabilize the pelvis. You want to have your head in a neutral position, so that what that means is we don't have the chin pointing up towards the ceiling. We want the chin pointing along the length of the body so that the neck is long at the back. Now, if for any reason you can't bring your chin down with the back of your head on the floor, you can bring a pillow in to lift your head up to give you that space. So hands in, elbows down onto the floor to start with. And then on an exhale, you're going to think about engaging these tummy muscles to pull the tummy in flat and lift the shoulders and the back of the head away from the floor. Now, what we want to avoid is pulling up through the chin. We're not curling our head up, because that means we're going to probably be pulling through the chin, through the neck, through the chest, rather than through the tummy muscles. So on that exhale, lift up, press those elbows down into the floor if you do feel like you're straining. If you find that you keep coming up and getting that strain in the neck and jaw, bring your pillow back in, elevate your head, and then as you're exhaling, the head might not lift, but the tummy muscles are going to be engaged. You're going to hold this for a count of 10 if you can. Now, if you get to maybe 2 or 3 and start straining across the neck, chest, or shoulders, then you're going to only hold for that 2 or 3, come back down, and then come back up, hold for 2 or 3, and come back down. If you can hold for 10, you then come down, take a breather, come back up, hold for 10. You want to do this about 3 or 4 times, and you want to do this exercise every single day. So the adaptation, if you can't bring your head up without straining the neck or jaw, is to have a pillow in there and just get that focus on drawing those tummy muscles in, almost like you're trying to use the tummy muscles to pull the ribs down closer to the hips as you're taking that exhaling breath. So really squeezing in here, thinking about getting this narrowing through the waist. That's going to help engage the muscles around the centre of the body so that we're taking the pressure off the back and working the core. Now, if you can get that lift with the elbows down, then you could start to lift the elbows slightly away from the floor so you're not anchoring them down and lifting up. And then when that becomes easy, we can take the hands out from the lower back, and then as we're lifting up, reach down as though we're trying to reach beyond that heel. We still don't want to strain, we're not pulling up through the neck, we're keeping the head back, and the breath stays really smooth. So that is exercise number 1. Exercise number 2, or the big 3, is the kneeling tabletop position, taking it into Superman. If you have any issues being on your hands and knees down on the floor, then skip forward a couple of minutes, because I'm going to show you a standing version of this exercise if being on your hands and knees is not possible. If you get a little bit achy through your wrists, you could bring in something like a yoga block to let your hands be on, so that your wrist can be near the edge there, and that'll take a little bit of pressure off. What I always recommend when we're coming into any kind of kneeling tabletop position is to bring our arms up. Think about these upper arm bones coming into the shoulder sockets, and then bringing the hands down onto the floor, then edging the knees so that the knees are underneath the hips. Considerations here: the centre of the body. We don't want the belly dropped down to the floor, but equally we don't want the back arched. We want to keep the spine long. So think about drawing these ribs in a good way to draw the ribs in is to giggle, or if that makes you feel self-conscious, do a breath as though you're steaming up a mirror. That'll help draw in the core muscles. Now we want to really anchor our hands into the floor. A few different ways to do this depending on what's going on for your wrists. You can press your fingertips and the heel of your hand down and make a doming effect in your hands, or you can take your weight towards the pinky side of the hand and press the middle finger down onto the floor, or you can really flatten the whole of your palm down into the floor. Everybody's going to experience this slightly different depending on what's going on in your wrist, so just having a play around to see what really helps you feel like you've anchored down. Then we want to lift one arm up, make a fist and push that arm forward, so almost like you're trying to reach to the other side of the room. This is what's going to help engage these tummy muscles a little bit more. And then the opposite leg we're going to extend out, pressing through the heel or pointing the toe. And as we're in this position, we want to check that the back hasn't dipped. So we want to keep the spine long. We also want to check that the pelvis doesn't lift. So think distance between the fingers, well, between the fist, between the sole of the foot. And you're holding that for about a count of 10. And like the last exercise, if 10 feels too long, you bring it down, you take a moment, you come back in. If you find when you extend your leg out that you get really wobbly, you can keep your toes on the floor and start with this. But just keep thinking long through the arm, really pushing the fist forward, and that will engage tummy muscles. Once you've done that for a count of 10, you bring it down, you switch over to the other side. Now, if you can't do this down on your hands and knees, let me show you how to do this at the wall. Okay, if the kneeling tabletop exercise is not available to you for doing the Superman, then what we can do is we can elevate our upper bodies up to take some pressure off the wrists. The two options for doing this, we could use a chair, have the seat of the chair facing you so that you don't pull the chair over. You bring your arms up, you draw the upper arm bones in, you'll lean forward so that you're leaning on the back of the chair, and then you'll bring your arm up, making that fist, thinking about that length. Opposite leg comes out, push through the heel, keep the ribs tucked in, keep the breath nice and smooth, holding that for 10, bringing it down and switching to the other side. If the chair is still not a comfortable option for you, then you can come to the wall, put your forearms on, take one arm up, push that fist up towards the ceiling, opposite leg comes out behind, push through the heel, making sure that the torso doesn't twist round, so keep it parallel to the wall, holding that for 10, bringing it in, and then switching to the other side. So that could be your beginner's level, or the option to take if coming onto your hands and knees is not available for you just now. Exercise number 3 is side plank. So this is to really help get these waist muscles working. Now there are lots of different variations of side plank. So the top level side plank would be your hand on the floor, your shoulder over the wrist. Now, like in the last exercise, you want to find a position for your hand that we can get this really strong connection. So for some people, pressing the palm really flat, for some people doming the palm, for some people on the pinky side pressing the middle finger down. Legs out long with the feet stacked on top of each other, then lifting the hips up, and then bringing this top hand up. We can take it onto the waist. You could reach up to the ceiling, you could reach overhead. If you get really good at side plank, you might lift your leg, holding that for about 10 seconds, gently bringing it down and switching to the other side. Now, if that is not available to you for wrist, shoulder reasons, you could come down onto your forearm. You could have your knees bent, but knees back in line with the hips, and then lifting up into this half plank where we could maybe have the top leg out long. We can maybe keep the legs stacked in front. If that is uncomfortable on the shoulder, Just check that you've not gone too far over the shoulder or moved too far away. We want to try and keep that elbow directly underneath the shoulder. Another way to come into that is from your kneeling tabletop position. So setting yourself up just like we did in the last exercise. Then you would lift and rotate your leg out, extend the other leg, and then open up, and then you can reach up to the ceiling, hand on the hip, hand overhead. Now when you come in from this way, you check that your hips don't sag back, so squeeze your backside, draw in, get that engagement. Really think about lifting up through the lower side of the body to get your engagement. Now if this starts to get comfortable, to progress from this position to the full plank, we can step that long leg forward, and then we can take the other leg out. So we've got a split stance, and then eventually work it to having the legs stacked. And that are your 3 exercises. So holding them for about 10 seconds, making sure for exercises 2 and 3 that you work both sides of the body. If the 10 seconds feels too long, do a little bit less, gradually build up over time. Make sure you do these exercises every single day and see how quickly you start to release that lower back pain. If you've got any questions or you would like to join me for my online Pilates and yoga classes, please do check the comments below for all the information. Make sure that you are subscribed, you like this video, you share it with anybody who could benefit from seeing these exercises. Thank you.